Pink October. So for those of you in the health care sector,
Yeah.
when October is coming, why is it? I don't know the kind of conversations you have on your corridors and among yourselves. Is it something you look forward to every year?
Oh, yes. It's something we actually look forward to. When we are in the month of October, there is that expectation from almost every facility, health facility, to try and make people aware of breast cancer, because we've realized that breast cancer is one of the diseases that is actually killing our women. And we want everyone to be aware of that. We want everyone to know more about breast cancer and look for ways to, deal with it and prevent it as well.
What is it about this particular disease that has made it such a big issue that the WHO would give a whole month, not a day, not a week, a whole month, and say, let's create awareness? Why is this such a scary proposition?
Okay, so the thing about breast cancer is that unlike most diseases that have a specific cause, so when we take malaria, for instance, we know that it comes from mosquitoes, or the causative organism is the mosquito.
Okay.
With breast cancer, there is no specific cause. That's what makes it scary. You don't know what you're doing. You don't know how you even get it. That's what makes it really scary. But then there are a host of factors that contribute to people getting the breast cancer. And it's sad to see that sometimes those who are actually at risk, so when I say risk factors, I mean those who have gene mutations with a specific gene that contributes to people getting breast cancer, those who are above 50 for women, those who are above 60 for the men, and then those who are sedentary. They don't engage themselves in any physical activity at all. All these risk factors come together to make people get a cancer. But then one thing about it is you could see someone who has all these risk factors, but the person will not get a cancer. Then you see another person who doesn't have any of these risk factors, yet the person will get a cancer. So we can't really look at people and say, well, these people have ever had breast cancer. You are also at risk. Okay. What happens is that the breast, when you take the female breast, I want us to picture it like a grape.
Okay.
You see, when you buy grapes in traffic, we have the grapes, and then we have this stalk or the peduncle.
Exactly.
To it, yes. So that's how the breast is. The cells that produce the milk are like the grapes. And then the stalk connected to the grapes
is a peduncle.
Exactly. That's
or the stalk.
Or the stalk.
Yeah.
So in our breast, it's just like that. The grape in this sense is called the lobules.
Okay.
So the cells in there are responsible for producing the milk. And then we have the peduncle from the grapes as ducts in the breast.
Yeah, they remove blood here and there.
Exactly. So when the milk is produced, it goes through the ducts, and then it is stored in a storage area called the ampulla.
Okay.
So that once a baby suckles, the breast comes. When a baby suckles, the breast milk is not now going to be produced.
It's already been produced and it's stored.
Yeah, it's stored there.
Okay.
Right. So what happens in breast cancer is that the cells in the milk producing cells, that are supposed to make sure that milk is constantly being produced, actually deviate from what they are supposed to do. So instead of dying at a particular time, every cell dies after some time.
Okay.
There are commands for that in our DNA. Instead of them to die, they keep living. Instead of them to die, they keep multiplying. Okay, so your time is up. You're supposed to die, but then you are now multiplying, and that's what starts the tumor. So when the tumor starts, the tumor doesn't want to stay at one side. The tumor finds itself moving through the ducts and then starts spreading to other parts of the body. That's what happens.
That's a very elaborate and it's a good explanation, and clearly tells us what is happening in the female's body and why the breast.
Yeah.
Now let's look at genetics. You said if you have a family member who has had it, then your chances are higher.
Yeah.
Right. So what is it about the genes that causes this? Is it something that is just nature just playing a trick on a particular group of people, or what?
Okay, so it's not about nature playing a trick. One thing about mutations is that sometimes they just happen.
Okay.
You can never tell. Sometimes they just happen. So there is this gene in the body. It's called the BRCA. We
Okay.
have the 1 and 2. These are responsible for the milk producing cells in our body. So they issue the commands: start producing milk, your time is up, die, multiply. They issue those kind of commands. So when there is a mutation on any of these genes, let's say the commands on the gene are supposed to go A, B, C. Mutation will make it go something like CAB.
Okay.
Now CAB means produce or
Okay.
multiply, when the actual command is supposed to be die.
Ah.
Do you get it? So when those mutations happen, then the breast producing cells keep multiplying instead of dying. And there is no specific cause to that.
It just happens.
It just happens. Yes.
In a fallen world, like how stuff like that
Mhm.
happens. Bad things just happen.
Yeah, bad things just happen.
Okay. Still on risk factors.
Mhm.
Lifestyle.
Lifestyle.
This is the Lifestyle, Leisure, and Business Radio. So
Mm.
anything to do with lifestyle, leisure, and business, we're interested.
Yeah.
When you say lifestyle is it's a risk factor, what do we mean by that? What kind of lifestyle are we looking at?
Okay. So as I earlier on mentioned, sedentary lifestyle. I mean, in this time or in this era where we have people working online, we have people who can be on their devices all day without moving out of their rooms. I think that they all contribute to you having the breast cancer, or they increase your chances of getting it.
Okay.
Because as you exercise, as you move about, as you become more active, your cells are really doing what they're supposed to do. They are active in your body. There is circulation and all that. Now, when you're sedentary, you're putting yourself at risk. Another thing is when you take in alcohol. Cancer and alcohol are like 1 and 2. Okay.
Oh, wow.
So when you read, it tells you that when it comes to breast cancer, if there's anything you do to stop taking alcohol, stop it. Because it doesn't mean that when you take in alcohol, it will give you breast cancer. No, it puts you at risk. But the fact that you keep taking the alcohol, even when the cancer has already started in your body, will give it more room to breathe.
Oh, wow. But women don't drink a lot, do they?
Oh, you think so?
Yeah,
I think some women do.
maybe the kind of women I know, but the kind of women I know don't really drink. I don't know. I mean, but that is a very, so listeners, still breast cancer awareness month is this month, and Vicentia Kolo is here with us. She's from the Shayo Sudoku regional or whatever hospital it is. I keep forgetting. I tried the whole of it.
District
It's
hospital.
district. I say it's regional. The Shayo Sudoku District Hospital. Where is that?
Dodoa.
Okay, Dodua. And we're talking breast cancer. The idea was to bring here for us to talk about comprehensive breast cancer management, but we just can't go into it like that. We need to level the playing field well enough. The myth of breast cancer, it's not only for women.
No, men can get it. It's very rare for men to get it.
We
but
don't produce
can.
milk, do we?
Yes,
Our breasts don't produce milk.
it doesn't.
So why are we getting breast cancer?
That's why it's very, very rare. I'll say that in 500 or in 1,000 men, you can find just about 2. It's really, really rare.
Okay.
Yes, it's really, really rare. Sometimes, I know the breasts of men don't produce milk. I mean, but then what happens is sometimes when men get cancer, okay, some of these cancer cells move and they find themselves in the breast of men. So for men, it doesn't start from the milk producing cells like for women. It could be any cancer in your body that has decided to start from the breast. Yeah.
Okay.
Or it could be any cancer in your body that has decided to move to the breast.
Another myth: breast cancer is not a death sentence.
Oh yeah, it's not. The good thing about breast cancer is if you are able to detect it very early, it's not a death sentence. Even when you have the cancer, there are treatment models to help deal with it. Yes. But personally, most of the breast cancer patients I've had unfortunately died.
Yeah,
Yes.
I was reading something that said in our part of the world, 70% mortality or something like
Yeah.
that. That's sad.
Unfortunately, they die mainly because they are not able to detect it early. By the time they get to the hospital, they've gotten to the end stage and things just get worse.
Okay, this one too is a very good question. Someone just sent this. Does a breast lump always mean breast cancer?
No.
How then do we know? Because how do we know this lump is not cancerous or this one is? And you see, let me try and be elder. How does the breast comes with lumps?
No.
So how come a lump is not always cancerous?
Okay, so a lump could be as a result of a swelling in a part of the breast.
Okay.
Sometimes ladies who know their bodies really well, who are able to do the breast examination for themselves after they've menstruated, realize that, oh, I have this lump in my breast. There was this time I took someone to the hospital and the doctor was saying that there was a lump in the lady's breast, but then the doctor was saying sometimes these lumps resolve on their own.
Okay.
Yes. So when you realize that you have a lump, the best thing to do is to visit the hospital or to see a doctor. When you see the doctor, you do the breast ultrasound. The breast ultrasound tells us the size. If the size is something tiny, sometimes it resolves. Okay. So if it doesn't resolve or if the size is big, then we start thinking like this is a big lump. What could be the cause? So we try to run other diagnostic tests. We could do the biopsy to take a part of the lump and then
test and see whether it's cancerous.
Exactly.
Okay.
So if it's cancerous, then we have to quickly start doing something about it. And if it's in the primary stages, you can easily just take out the lump and then the person is okay. But then after taking a portion of the lump too, we are not just looking at whether it's cancerous or not. We are looking at whether it is traveling to other parts of the body.
Okay.
Yeah. So if it's traveling, then it means there is danger. Like something has to be done immediately.
You said those who know their bodies and they're able to examine their breast after they menstruate. Now, what is the special skill needed in examining your own breast?
Okay, so as a lady, I always advocate that you should know your body well. After menstruating, people usually do it a week after menstruating. I think that's the ideal time because when you're menstruating, sometimes your breasts become heavier. You can't do that, or you'll not get the good or actual results. So when you are done menstruating, you want to stand in front of a mirror as a lady, and then in a circular motion, you massage your breast. I wish we could do a video something for people to see how this will be done. On dummies, not on me.
I'm just finding. I'm like that.
Yes.
Okay.
So you want to stand in front of a mirror, one hand behind your head to give you full access to your breast, and then you go in the circular motion. You could also go in the wedge direction where you go longitudinally.
Okay.
So while doing that, you should be able to tell if you have a lump in your breast. Now let's say there is a lady who really knows her breast well. She knows that there are no lumps in my body. If she does the self-examination this month, next month she does it and she realizes that no, there's this tiny thing I'm feeling. That person knows their body, so they are able to do something quickly about it. As compared to people who are just there, like they don't know their bodies.
Yeah, is it a myth that men have a role to play in this?
Oh, I hear that a lot. That's
that's why I want to ask.
Yes. So scientifically, there is nothing like that. That suckling, fondling would help reduce like someone or reduce the
You,
risk
you
of
just
getting
spoiled
pregnant.
somebody's night. I mean, because I have also heard that a lot, that, ladies, let the men use that thing so that it reduces. It doesn't help at all.
There is no proof that it does. What
Oh.
we
Charlie,
the
we
men
say
are
shit.
more concerned about breast cancer than the women. So what we advocate is that for married couples, okay, you have seen your wife, you know how your wife's body is. If as a man you detect any changes, you realize that your wife's boobs are getting swollen, or there is a change, discoloration, there is flaking, your wife's breast looks like the orange peel. See, when you take the peel of the orange, there is this pore.
Yeah, dot
Really-
things on
exactly,
it.
really
Okay.
dotted. So if you realize that your wife's breast is changing to that, I mean, it's a cause for alarm, because these are cardinal signs for breast cancer.
I mean, anytime I hear this part of the conversation, and what men have the time to be studying their wife's breast like that? I mean,
Oh, I mean, as long as it's your wife, you should.
okay, Strip, let me check since last week what has changed or what. Anyway, I mean, I need to be a better this thing in this direction. Yeah. So now the person has come tested, the one has breast cancer. WHO, among the 3 cardinal pillars they were talking about, is comprehensive breast cancer management. What does that mean? Well, the person has it. What are we doing about it?
Okay, so one thing about breast cancer is we don't only deal with the cancer. We deal with the individual holistically.
Oh, okay. Oh, wow.
Yes. So everyone, when they are told have cancer, is very likely for the person to, I mean, get depressed.
Yeah, you'll be scared.
Yes, you'll be really
Yeah.
scared. I mean, and sometimes the psychological effects of they hearing the diagnosis, it's even worse than the disease actually. So what you want to do as a nurse is to make sure that you are treating the person holistically. You are dealing with the psychological aspects of the person. So you want to encourage the person. And breast cancer doesn't mean you are going to die. Given
I
that,
think we need to repeat that.
yeah, it doesn't mean that you are going to die. Given that you are able to detect it early. That's why I am still hammering on this. Know your body. Know your body. So that once you detect the lump, you rush to the hospital. Now, after dealing with the psychological aspects of the body, you want to take the pharmacological aspects as
Okay.
well. If the cancer has spread, let's say it has taken over all 2 breasts, and the person is starting chemotherapy, you as a nurse is supposed to administer all these prescribed medications as the doctor has prescribed. Okay, and then you want to give analgesics, pain medications as well, because cancer usually comes with pain. They are in so much pain. Aside that, you also want to consider things that are not in the line of drug but will help deal with the pain.
Okay.
So there are things like diversional therapy. Sometimes when people are alone, let's say you have one person who has been diagnosed with breast cancer. The person lives alone. When they are alone, they think about the cancer a lot. I mean, when you are in your alone time, like you are alone,
Okay, yeah.
you think about those things. But then if you have someone around, someone to talk to you, someone to encourage you, someone to, I mean, try and engage in fun activities, you are likely to take your mind off all that. So sometimes we do those things. We do the diversional therapy. I mean, if it's in hospitals where relatives are allowed to have some time with their people, I mean, you can have relatives around to chat with them. You as a nurse should also be friendly to the person, try and engage them in conversations. And then other ways are to try and, let's say, television, occupational therapy, play games with them and those things. They all help to take their minds off. So you are dealing with the person as a whole, not just the cancer.
The cancer itself. Is the fear of breast cancer not also linked to this impression or perception, if I could say, the perception we have that it means your breast is going to be cut?
Okay.
I mean, is that not feeding into the fear women have when they
Yeah.
are diagnosed?
Yes. most, I'll say all women
Yeah, I think
are
so.
particular about their breast. Okay, so comes back, know your body. When you know your body and you detect it early, as I said, if the lump is cancerous, but it's just at one point, we can just take out the lump and then you are good to go. Okay, and that's when you do the surgery. But in instances where people don't know their bodies, or people have even realized they have the lumps, but they have not come to the hospital, or they have not done anything about it and it spreads, would have no option than to take out the breast, and that's mastectomy. I have seen people who have gone through mastectomy, and I mean, it all starts from the mind. There are some people that realize that, wow, if I have to go through this for me to live again, then why not? I'll give it a chance. And you see, when the cancer is still in your body and then it's spreading, I mean, you are giving yourself the opportunity for more diseases to come. I mean, the cancer is spreading, and then before you know it, the breast cancer is now another thing, cancer, and all that has spread to the body. So for you to, I mean, be able to be free from all these, if there is mastectomy, that's when the cancer cells have spread to parts of the breast, we can take it all out. But there are reconstruction surgeries for that. We could fix the implants, and sometimes people fix the implants and they have really nice boobs as compared to before.
Yeah.
Yeah, so that's another option.
What kind of counseling are you giving to a woman who is about to lose her breast?
The counseling I'll give to, before that, I would want to know if the person is done giving birth.
Okay.
These are factors we consider for young ladies who have not given birth to any kids. We should reconsider taking off the breast totally. Or if there is the need for us to do that, there should be remedies like the implants for us to, I mean, fix it there. So if someone is about to go through that, my counsel to the person is, if you've already given birth to all your kids, then for beauty, I mean, everyone wants to have the breast. Let's consider getting the implants, okay? So that although you don't have the natural breast, you still have the implants in there, and then you have fine boobs as well. The next thing I would consider doing is to try and engage the family in this kind of care, because sometimes having people you love around, having people who care about you around also helps. And then when you know that you can make an informed decision that would, I mean, that is curative, okay, that would end up in you having a healthy life, it's best to take the chance.
Okay, once again, let me ask another very ignorant question. A lady who undergoes mastectomy and then she does a reconstructive surgery, she has, I have heard, they get worried that it will not have the same feelings or the same, I don't know what word to use. It looks it is artificial or something. What do you tell a woman like that?
Okay, so the sensitive part of a lady's breast is the nipple.
Okay.
So we are not going to take out your nipple, and or if we are doing a reconstructive surgery, what we are going to do is we are going to take out the cancerous or the tumor in the breast, and then if there is a need to fix in the implants, we put it there. Now, trust me, there are people who have gone through this, who have done the implant thing, and their boobs look firm and nicer than it was before. Maybe they had sagging breasts before, but then
by this time around, they can choose what they want.
Exactly, they can choose what they want, and it's now firm and standing as they want it. Okay. Plus, you still have your nipple, which is the most sensitive part. So if for those purposes, you know that, I mean,
you're good.
You are still sensitive. You're good.
Nice. It's about just 10 minutes to the top of the hour. We're talking breast cancer, not breast cancer. Let's add the cancer before I get a call. And Vicentia Kolo is here. She's giving us some very important information regarding breast cancer. She's talking to her ladies her sisters as well, about the need for early detection. What would you advise any lady listening to us to do this morning?
Okay. So this morning, to any lady listening to me, if you had your menses last week, last 2 weeks, try and do their breast self-examination. For this month, there are going to be a lot of screening exercises free of charge in every hospital. I mean, my hospital is doing that, and I know there are lots more hospitals that are doing that. Come Saturday as well at Makola, we are going to have a breast screening exercise for our market women.
Oh, wow.
So you want to pass by, you want to go into any health facility for your breast to be screened, do that. And after your breast is screened at the hospital, try and know your body. When you know your body, it's good to be able to tell that I have a lump in my breast yourself, than for you to wait for it to start spreading, and then you start feeling the pain or you start getting a discharge from your nipple. Then you ask yourself, when did all this start? All this started when you decided not to take care of your body, or when you decided not to know your body. Yes. So know your body.
Know your body, ladies. Know your body. But let's debunk this one for the very last time. You are saying that men using the thing doesn't stop cancer. I think we need to settle on that, because Vicentia, I think that question we need to answer it again. How
I've destroyed plans.
I don't get this one, because I've heard it somewhere. Have you not heard it before?
I've heard it countless times. I have.
Hey, I've heard it before that, ladies, okay, but you say the man should actually know the woman's breast as well.
Oh, yes. So that if there is any change, I mean, you can contribute to trying to let your wife get that care she needs, or the immediate attention she needs. Because if you see the person in your room every day, you know the person's body as well, you should be able to tell, oh, Charlie, like, I think that your one part of your breast is becoming more bigger than it was, or I've realized that there's this redness, or why is a part of your breast flaking? Why are you getting discharges when you are not giving breast milk to a baby?
Yeah.
So you should be able to tell that if you have a wife, you are close to the person, you know the person's body. Yes, and
men should be concerned. They should be concerned about the breast.
Exactly.
So for the last time, men playing with the breast does not stop cancer. It doesn't change anything.
Yeah.
Especially to the hordes of bachelors within Z Multimedia. A hordes of bachelors within, because I can mention 10 off the top of my head. Number one is warning me, Abdullah Isaac. Using the breast doesn't change whether you get cancer or not. Listen to what Auntie Vicentia is telling us. Okay, so final words before we ask you to go back and help those that need your help all the way in Dodowa, the Shai Osu Doku District Hospital. Yeah. This month is a breast cancer month. You've spoken to your ladies, know your body. Is it expensive managing breast cancer?
It is.
Oh, wow.
It's expensive managing any kind of cancer. Chemotherapy is very expensive.
Ouch.
We are talking about figures above 20,000 for chemotherapy alone. That is when we've not even talked about things like diagnostic investigations, like doing the biopsy, mammogram. We've not gotten to that stage. Just chemotherapy. That is after you've been diagnosed with a cancer, after we've realized that it has spread, after we've realized that, you need this therapy for us to treat it. Chemotherapy is expensive. So that's why there is this awareness. I mean, it's a sense of urgency. You don't want to wait till you've gotten to that stage and then you start asking yourself, had I known? Or you start asking yourself, where did I go wrong? Know your body. Know your body.
Know your body. Vicentia Caller from Shai Osu Doku District Hospital in Dodowa. Thank you so much. Mrs. Linda Abbey, I've gotten your message. I won't mind I'll pray for you after. Thank you so much for joining us this morning on Z 101.9 FM. We're so honored to have had you here.
Thanks for having me.
Enjoy the rest of the day and the rest of the month as well.
Sure.